There are so many details to Medicare that it can make for a lot of questions. This show is dedicated to answering those Medicare questions one by one and serving as your resource in the modern Medicare world. This is Medicare Made Simple with Kevin Geiger.
Welcome to Medicare Made Simple with Kevin Geiger of Carolina Medicare. I'm Mark Elliott, and you think about it. Why in the world would Kevin want to do an entire show on Medicare? And it's a great question. There's no doubt about that. But what you don't know, you don't know. And when it comes to Medicare, what you don't know might be costing you money. Kevin, welcome to the program. We got a lot to cover today.
I appreciate the intro. Yeah, no, it's Medicare is such an important thing for anyone coming into retirement. But again, my name is Kevin Geiger. I'm the owner of Carolina Medicare. We're Low Country's fully independent Medicare advisory firm. And I always like to point out we're free of any influence from any insurance carrier because we are independent, meaning we don't sell just one company. We sell everything that's available out there to make sure we find the right fit for you. Our services are always free to our people. And the biggest thing is our goal is to really kind of guide everyone through that Medicare maze, because if I say anything government related, whether it's Social Security or something like that, there's a lot of pieces to the puzzle, and you need someone to really help you along with that. So we can be reached at 843-868-MEDI, which is 6334, or you can go to our website at carolinamedicare.com. And Mark, we talk about this all the time, but we do a lot of workshops, especially now that things are kind of calming down a little bit. We're getting ready to start doing some live workshops, and we do this all through our non-for-profit Retirement Focus Academy. So we set this Retirement Focus Academy up last year because of the idea that we started realizing that people just needed assistance. They didn't want to feel like they were sold anything. They just wanted a resource to go to. And so we created this academy to really kind of educate people not only on Medicare, but everything revolving around retirement. And that's always free of charge to our clients as well. And the website for that, if you want to check that out, is retirementfocusacademy.com. Again, retirementfocusacademy.com.
So Medicare. Medicare is the largest health insurance program offered by the United States government. It serves more than 55 million people, and it's run by the Centers for Medicare and Medicaid Services, which is part of the U.S. Department of Health and Human Services. You think about all this, Kevin, Medicare can get so confusing, and we're going to get into why this is an important time period for you at Carolina Medicare and why it's important for those that are on Medicare Advantage plans or Medicare Supplement plans or Medigap, which is kind of the same thing as Medicare Supplements. We're going to get into all of that. But you think about it, I think we get confused by a lot of this. There's so much terminology. I've got, Parts A and B, Original Medicare. Part C, Medicare Advantage. Part D, prescription drug coverage. And then you throw in Medicare Supplements and all this stuff. Talk a little bit about Medicare Advantage plans versus Medicare Supplement plans. They kind of do the same thing, but they do it in a little different ways?
That's correct. Yeah, so there's a lot of confusion, and we always have people come in and going, well, I need to sign up for some type of Medicare Supplement or Medicare Gap, and I'm always asking them, are you looking for a supplement plan or are you looking for a Medicare Advantage plan? And then all of a sudden their eyes light up and they go, well, what's the difference, right? So there are really two separate types of plans, right? You've got the Medicare Supplement plans, which, is your G, K, L, M, and N, all the kind of stuff that's out there, which there's a lot of letters. Just to confuse people even further. But, they kind of grade that in a system to depend on what types of coverage you want to have. So obviously the G would be your best, bells and whistles type of plan that's going to cover the most, but it's also going to be the most expensive and things like that. Then you've got your Medicare Advantage plans. And now these are what I call the competitive type of insurance plans. It's not going to have the best bells and whistles to it, but they're going to be cheaper, and sometimes they're actually free to the participants that are in these plans. And so they kind of, entice you with some extra options, maybe have a gym membership and things like that are kind of thrown into these plans. And so those are kind of, set aside. So there's two separate sides to it. And I always tell people, do you want to pay more now or do you want to pay more later? And that's kind of where it kind of comes down to. But everyone's situation is different, and certain plans will work better for some versus other. And then, of course, you got the prescription drug plans, what they call PDPs, which is your Part D. And, Medicare Advantage can have that built into it, or you can do an individual plan itself, which covers all your prescriptions and things like that. So, if you have to take stuff for whatever reason, that's what you got to have that plan there for. So those are the kind of the differences to it, but everything is custom to what the needs are for each, Medicare beneficiary.
So when you reach out to Kevin at Carolina Medicare, it's 843-868-MEDI, M-E-D-I, MEDI, for Medicare, right? 843-868-MEDI, and the MEDI is 6334, 843-868-6334. And as Kevin said, there's no cost for this. You will never pay Kevin anything. If you do something with Kevin to help your own situation going forward with Medicare, Medicare Supplements, and Medicare Advantage, and all of those different types of plans that we have available, and you don't really understand it all, that's why you talk to Kevin. He's not going to charge you anything. He makes money from the insurance companies, but he's looking out for your best interest. He has, as he said, all the opportunities to go to different insurance companies, because when you get into all those letters, basically, Medicare supplements, they all have to have the same things in them. And at Part G, for example, that Kevin mentioned, all the companies will have the same things in them, but they can charge you different amounts for that. And it depends on what state you're in. If you move to South Carolina from another state, your stuff might not be actually what you thought it was when you left the state previously. So there's a lot going on. It's 843-868-MEDI. That's 6334. And you think about it, Kevin, when we get into all of this that can get so complicated, I guess the number one question is, when I come in and sit down with you, because I'm 60, so I've got some time, right? I've got, 3 months before my 65th birthday, the month of, and 3 months after, so I've got a 7-month window to sign up for Medicare. I guess my first question would be, well, Kevin, will I even need this? Am I going to be healthy forever? You're going to be the doctor and pull out your crystal ball and help me decide which way to go?
Right. I mean, that's really what it comes down to. You don't know what your health's going to be, but the fact of the matter is, as we get older, we all have new health issues that come about. I know even for myself. I mean, I found out a year ago I have plaque psoriasis that I thought was just dry skin in the bottom of my elbow. Who would have thought, would have had something like this?
Exactly.
So, I always tell people when they come in, I go, you got to look at things down the road. My job is to think about, 10 years from now, 15 years from now, how are your health going to be at 75 or 80 or 85? The reality is most likely something's going to happen at some point. It's just the law of numbers, right? So we got to make sure that we have the right plan. And I always tell people, if you can afford what I always call the Cadillac of plans, right? Like the Plan G that covers all these extra things. You might not use it for the first 10 years, but that one day when you find out, you've got cancer or something like that, where you're going to have to go into treatments, every week or every other week, and you have a plan that's going to cover all this stuff versus having to pay co-pays every time you go in, that's the day you're going to go, you know what? That was the right decision I made at that time. I'm glad I went with that. But then they're going to have other people that are going to be, not going to be able to afford the Cadillac of plans. So in those kind of scenarios, maybe a Medicare Advantage plan will work out. Maybe income-wise, you might qualify for state help, which might actually cover the premiums and some of the co-pays, and all of them are, so there's a lot of situations where everyone's situation is individualized, and I always point that out. Everyone's situation is individualized, so the idea of sitting down with someone, make sure you're finding the plan that's going to best fit you, is the number one thing you should be doing.
Yeah, and think about this. If you are one of those, because we are in a healthier environment than, say, our parents and certainly our grandparents were, they didn't really pay attention. They were smokers and drinkers and the like. We don't have as much of that, I don't think, certainly in the smoking area. But the better care you take of yourself, that means the longer you're probably going to live and the more issues you might have down the road. This is a big month at Carolina Medicare. For you and your team, it's super busy. Why is October, and we're early October now, why is this such an important month?
Gosh, we are 11 days away from AEP, which is an annual enrollment period. This is, I would say the most important time of anyone that's currently in Medicare to really evaluate what's going on with their current plan. And so back last month in September, you've been receiving your annual notice of change. Now, I can tell you just from experience from the people I've sat with, not many people really look at that, let alone dissect it and really understand what's changing in their current plan. So we sit down with our current clients right now, for example, and we evaluate their current plan. We evaluate their current health to find out, if something changed, is your current plan really going to cover that stuff, or should we be looking at other things? So this is the most crucial time. So just like, for myself, right now, since I'm not 65 and able to qualify for Medicare, I'm still going through the healthcare, marketplace, which kicks in November 1st for myself. So I've got to evaluate the plans and make sure that I'm in the right plan for myself and my family. So these are the crucial times that everyone needs to be doing this, but they don't want to wait till the end of November or beginning of December to start making these changes. You got to start looking now, because the changes that you make now, or if you leave your plan alone, are going to affect you comes January 1st.
So this annual election period runs from October 15th through December 7th, and it does so every single year. You can switch from original Medicare to Medicare Advantage or vice versa. You can switch from one Medicare Advantage plan to another. If for the first time you're enrolling in Part D, you can do it now, and you could have a late enrollment penalty possibly. But you can also switch from one Part D to another. So it's Medicare Advantage plus Part D, the prescription drug part of this. Do you see people make mistakes when they're picking these Medicare Advantage plans?
Oh yeah, all too often. Yeah, too many people, and I would say that now the newer generations that are turning 65, they are the do-it-yourselfers, as I like to point out. They're the ones that have been managing their 401k. They've been doing everything on their own. So they decide, well, we can just decide how to do our Medicare stuff. And what they do is they focus on the monthly cost versus looking at the right benefits for themselves. For example, are all your doctors that you're currently with, are they all in your network? Is the drug plan covering all the drugs that you and your spouse have, are using? And then, of course, one of the biggest ones I always say, Mark, is the hospital stay cost. People never look at the fact that, because let's face it, I don't want to go to the hospital anytime soon, but things happen, right? We're going to end up going there at some point. But what they don't realize is some of the plans might be cheaper because the hospital stay charges a per day versus a per visit, which could just decimate someone's retirement savings account. So that's something people just don't look at. So I always say you got to look at the true end of the year cost. What's that plan going to cost you at the end of the year? Because it might be cheaper monthly, but your overall cost could actually be staggering depending on what goes on with your health through the next year.
Yeah, and we've talked about this before. We don't typically shop our car insurance or our cell phones because it's just a hassle to make changes. Would you say Medicare beneficiaries are creatures of habit when it comes to their Medicare Supplement plans or their Advantage plans?
Yeah. I think it's just human nature, right? We're all creatures of habit. We don't like change, right? I don't know about you. It's sometimes hard to change. And I think as we get older, and I know as I'm getting older, I find myself kind of pulling back from making changes because you just get used to things. But, all too often you see that and they don't make the changes like they should. They're not looking at that annual notice of change letter that's coming out talking about what's going on with the changes inside their plan. And then maybe sometimes they get too loyal to the company they're with and things like that. But you've got to evaluate things, and you got to realize healthcare is probably the second or third most expensive expense you're going to have in retirement. Why wouldn't you be looking at it to make sure that it's not going to affect your retirement? So you've got to focus on that. You've got to understand where you're at right now. Is the plan make sense for me right now, or should I be making changes to that? And that's why utilizing our service, which is free, again, free to our clients to come in, let us evaluate all this stuff, make sure that the plan that you're currently still in makes sense for you. It's only going to help you in the end, and that's kind of what our main goal is. And that's what we want to do for our clients.
Yeah, and it's a great service. I mean, you're not charging anybody anything because you're an independent person at Carolina Medicare. You're here to help. You've got a lot of contacts at all the different insurance companies, so you have everything in front of you. Now it's a matter of you doing the due diligence, figuring out what's best for whomever you're sitting down and talking to. You think about brand loyalty, and you think of, I'm a Chevy guy. I like Camaros and Corvettes. I've got a buddy that loves the Shelby Mustang, so he's a Ford guy. So he's wrong. He should be a Chevy guy. But do you ever find in this world, that somebody becomes a little bit brand loyal when it comes to this insurance world?
Oh, yeah. I'll give you a couple examples of that. You've got people that leave their job and they're with one company. Let's just say it's Blue Cross Blue Shield, and that's what they had for their health insurance. And they felt like, well, this plan's been good for me during my employer days. And now I'm in retirement and I need to sign up for Medicare. And so they end up signing up for the same insurance company because they just think, hey, well, that was good for me then. But what they're not realizing is it's probably not going to be good for you now because you don't know what types of coverage you're really going to need unless you look inside there to find out if every doctor's in the network, if you make sure your drug coverage is all there. And you're looking at all these things that are most important to you. You've got to evaluate that. And the second thing that I see quite often is you got the husband and spouse that are both on with the same company, and everyone's needs are different. And Medicare is individualized. I always kind of point that out. So when you're looking at this, you've got to realize that not every plan's going to fit, the needs of everybody. Your wife might have different medications, see different doctors. So you've got to evaluate all this stuff to make sure that you're in the right plan. Because at the end of the day, looking at these plans, whether it's brand loyalty or other reasons, is only going to help save you money. And in this day of age, especially with the Medicare Advantage plans, it is getting so competitive these days because every insurance carrier is trying to gain market share right now. So taking advantage of looking at all these extra bells and whistles you could get inside these plans, and maybe you might find out it's going to save you a couple $100, maybe $1,000 or more next year. Could be, another trip that you could take, for yourself or with your family. I mean, everything could change if you just look at what the options are out there.
And we've got a lot more to get to, Kevin, in the next part of our show. But right now, why don't you talk a little bit about your Medicare workshops that you mentioned at the top of the show? They're run through your non-for-profit Retirement Focus Academy.
That's correct. Yeah. So again, we created the Retirement Focus Academy specifically to provide, education, whether it's regarding retirement, investments, whether it's regarding Medicare, whether it's regarding long-term care, everything is surrounding retirement. We've set that stuff up. And now that things are kind of lightening up, we're getting ready to start doing these live events. We're going to have probably about 8 people there following the CDC requirements to really give you an opportunity to sit down, be educated. We give workbooks to kind of, take notes and everything else. And we do this because we want to help our people to make sure that they're fully understanding what they're doing and kind of guide them along through retirement so they don't make those costly mistakes, because that's where it could destroy your retirement. So go into the retirementfocusacademy.com. We'll kind of give you some ideas as far as what we have out there, as far as workshops coming up and so on.
Yeah, so a couple websites to remember. Kevin just mentioned it. Retirementfocusacademy.com is one if you'd like to learn more about how all this plays out. You also can go to Kevin's website, carolinamedicare.com, and learn more about the team and what they're doing, because Carolina Medicare serves the Lowcountry, right? The Charleston area, Myrtle Beach, really the entire state of South Carolina, carolinamedicare.com. But if you just want to pick up the phone, 843-868-6334. Back with more of Medicare Made Simple with Kevin Geiger of Carolina Medicare. Stay with us.
You're listening to Medicare Made Simple with Kevin Geiger. Open enrollment begins October 15th. What questions do you have about the process? Call 843-868-MEDI.
It's the time of year to review Medicare plans, and the Medicare plan that was right for you last year might not be right for you this year. With so many moving parts, many things can change, and last year's good provider might not be as good in 2020. Coverages, co-pays, prescription formularies. You need somebody you can bring your questions to. Someone independent. Someone who puts your best interests ahead of their own. Let Kevin Geiger of Carolina Medicare be that person. Kevin can help you review your options for 2020. To set up a one-on-one visit, call the office at 843-868-MEDI. That's 843-868-6334. Or sign up for one of Kevin Geiger's upcoming webinars at carolinamedicare.com. That's carolinamedicare.com. Let's get you settled into the right Medicare plan for next year before December 7th rolls around. Kevin Geiger at Carolina Medicare. Call 843-868-MEDI or visit carolinamedicare.com.
You're listening to Medicare Made Simple with Kevin Geiger. Online at carolinamedicare.com.
Welcome back to Medicare Made Simple with Kevin Geiger of Carolina Medicare. I'm Mark Elliott. If you have questions or concerns, you're in that 64 age range and obviously upwards, because Medicare has an open enrollment period. It's called the annual election period. It's from October 15th through December 7th every single year. So Medicare Advantage, it's your chance to make some changes if needed. If you have Part D, the prescription drug, and so maybe you're not Medicare Advantage, maybe you're Medicare Supplements or Medigap, which are basically the same thing, but in those you have a Part D. Well, this is your opportunity to make some changes. And that's what we're talking about today. You can find out more about Kevin and the team at Carolina Medicare on their website, carolinamedicare.com, carolinamedicare.com. You have questions, it's 843-868-MEDI, which is MEDI, 843-868-6334. And remember, Kevin, you don't pay Kevin for his guidance. The insurance companies do that. Kevin is independent. He's not answering to a board of directors or an insurance company. He's looking out for your best interest. And then he's searching for the best fit for your situation. He works in the Medicare world. You don't. You don't understand it, maybe. I don't understand it. That's why we're doing this radio show, hoping to give you some insight, especially if you get into that 64, 65-plus range where Medicare is super, super important for really everybody of that age. We've got to have the right plan for our situation, and there are so many options out there. It can be very, very confusing. When it comes to Medicare, Kevin, and all of the different options, do you find people get more confused about the differences, say, in a Medicare supplement versus a Medicare Advantage plan?
They do. Like we talked about in the first segment, people just don't understand there's a difference between the plans, right? So they go, well, I always thought it was a meta gap. That's what I'm doing. I'm filling this gap between, what A and B covers and so on. But there are some differences to it. What I explain to people is when you're looking at a supplement plan, I always point out they're going to be the more expensive plan. They're going to have better what I call catastrophic coverage. When you get sick and things like that, those are the things that are going to cover you the most at those times. But Medicare Advantage plans tend to be either free or they tend to be, a lot cheaper than a supplement plan. And a lot of times they have more bells and whistles today. For example, we talked about the gym membership and things like that that could be thrown into these plans, but they could be more costly in the end. So I always tell people, do you want to pay more now or do you want to pay more later? This is where it really becomes a big struggle with this. And I'll give you a story where we ran into this issue not too long ago with a client that was in a supplement plan, took the lowest plan, letter, if you want to call it, for the supplement plan. Unfortunately, they ended up getting sick and found out that, their plan K, for example, only covered 50% of the deductibles and coinsurance and all that nonsense, and found out it was going to cost them a lot of money. So we were in open enrollment. This was last year. And with this person, we were able to actually just switch them to an Advantage plan, the best Advantage plan we can have that actually had better coverage because of the reason that if you're switching to a higher or better supplement plan, you're going to be subject to underwriting. This is a big issue that people don't think about. Advantage plans, which is nice, is you can switch between those all day long. There's no underwriting. The one time you find out you're sick is...
Underwriting means what? Underwriting means I have to go to the doctor and get that my health is okay? Is that what underwriting is?
Underwriting is just like a life insurance policy. You kind of go in, you got to, figure out what they're going to look at your health. They're going to see, are you healthy? If they find out that you have cancer and things like that, they're going to rate you, meaning that premium that might cost you $180 a month might end up costing you $400 a month, for example, because you're going to pay more for that coverage because of your current health scenario. With a Advantage plan, there is no underwriting. So I've run into scenarios many times like this one where we had to switch them from their Plan K supplement plan into an Advantage plan to give them better coverage for even in some cases less, which was a better scenario for them. So there are situations where, moving to the other side of if you want to call it the other world, what I call supplement world and Advantage world are like two separate sides of the planet. But in the same ways, they're all there to, benefit what we call the Medicare beneficiary out there. So it just depends on your scenario, and this is why you sit down with us so we can help figure out what's going to be the best fit for you. Even if you're in a current plan, maybe that plan is just not right for you. And right now with this open enrollment, this is the time to really evaluate that, and that's what we're here for.
Yeah, and that open enrollment, the dates are October 15th through December 7th, so you can switch from original Medicare to Medicare Advantage or vice versa. You can switch from one Medicare Advantage plan to another. And then, of course, whether you have Medicare Advantage or you have Medicare Supplements, and Medicare Supplements same as Medigap, Part D, drug prescriptions is one of these opportunities as well that you can change at this time period, October 15th through December 7th. Do you ever run across somebody, Kevin, that says, hey, my buddy's got this plan, it's the best, and you should do the same thing I'm doing because it's great?
Doesn't everyone always listen to their friends when they say, hey, you should buy this is the best thing ever, and then they find out later it was not? Well, there's just, scenarios like that all the time. We've had a client in the past, same scenario where they were listening to the friend. They called us and, hey, I want to sign up for this plan. This is what they told me to do. And they told me to wait to take my Part B and don't do this right now. And then after we evaluated everything, we said, no. If you don't take that Part B right now, you're going to be subject to a penalty. And that penalty was going to be a 10% compounding penalty each year he didn't take it because his friend said you could do this. And turns out that his friend was completely wrong. He told his friend about it. His friend ended up calling us frantically saying, how do I fix this before I get in trouble? So there's scenarios where, you can't listen to that person. I don't know if you remember that one commercial, and this one always strikes me in the back of my head, is you had that guy who was, doing construction on the road, had the jackhammer thing going to the ground, and he's giving a person advice about medication, because he was the doctor, if you want to call it. Well, it's the same scenario. You can't just listen to your friends to give you advice on, especially medical stuff. Your second most expensive expense you're going to have in retirement. You've got to listen to the experts, the people that know these plans and know where you're going to get penalized and things like that to make sure you don't make those costly mistakes.
So again, the number, if you have questions or concerns, and boy, this open enrollment, I'm not sure what I should be doing. Should I be doing anything? I don't really know. Well, that's your opportunity to talk with Kevin Geiger at Carolina Medicare. The services are always free to the clients at Carolina Medicare. Kevin's goal is to guide you through this Medicare maze. The number, 843-868-MEDI. That's 843-868-6334. 843-868-6334. I'm Mark Elliott, Kevin Geiger with Carolina Medicare. This is Medicare Made Simple. Glad we're with you. And you can tell that it's not simple, but Kevin's trying to make it simpler for you. Medicare Supplements, Medigap, same thing. Medicare Advantage, Part C, same thing. So the terminology can make things really, really confusing. And I think, as you just said, the person's getting advice from a friend. The advice was wrong, but he didn't know that because he didn't understand it either. He goes, well, that makes a lot of sense. Boy, that works out great for you. I think I should do the same thing. Great. And then it turns out it was wrong advice, which could have caused him a lot of cash, basically, because doing the wrong thing and getting penalized and all of that. Talk about the general lack of knowledge and lack of understanding that most of us have with this Medicare world.
Well, I think it really comes down to the fact, like we talked about before, people get so tied up in cost that they don't look at the benefits inside their plan to make sure they're actually being covered, to make sure that every time they're going in for an MRI, is that being covered? Are there doctors in network? Are there drugs that they have to currently take? Are they all being covered? Or are you going to be paying some bigger expenses outside of that inside their drug plans? I mean, there's things that you got to really understand. And I always talked about, you got to understand the copays. You got to understand the per visits to go into the hospital. There's all these little things that you've got to really get in the back of your head on is this plan right for me? And this is where we come in, because our job, because we're free of charge to you, is to look at your current situation, understand where you're at, understand where your spouse is at, and make sure that we're picking the right plan for both of you. Because each one of you are going to be individualized, where you're going to have, in most cases, a different insurance carrier and a different plan based on your current needs. And that's important for people to understand. Don't always go together in the same company. Make sure the plan is fit for you. At the end of the day, it's all about cost and how you're going to affect your retirement savings. And for me, if I'm in retirement, I'd like to know I have every extra dollar to go do something, travel the world, do things that you want to do in retirement. Because at the end of the day, I want to enjoy my retirement. And if I have to worry about this cost decimating my retirement savings, that's not going to be a good thing. So make sure that you're in the right plan. Use our services. It's here for you, and it's free.
So I would say it's not unusual to have, say, the husband's with Medicare Supplements and the wife is with Medicare Advantage, because it makes the most sense, because it's all about whomever you're sitting down with, right? I mean, you could have a couple that's doing one or the other, right?
Absolutely. And you might have them two different Advantage plans altogether as well, because her doctors are in network in one plan where his are in a network in another plan. I mean, it really comes down to what your current situation is, your current health, your current doctors, your current prescriptions, and making sure you have the right fit, or at least the best fit. Because in some cases you might find out that not all plans are going to cover everything, but what's going to be the one that's going to save you the most at the end of the year? Because it's about the end of the year, not the monthly payment, at the end of the year cost and how much you paid in for your health cost.
Remember, this annual election period, open enrollment, October 15th through December 7th. You can go original Medicare to Medicare Advantage or vice versa, or change Medicare Advantage plans. And if you have prescription drugs, Part D, then this is an opportunity that you can make some changes if needed. Call the team at Carolina Medicare and Kevin Geiger. It's 843-868-MEDI, 843-868-6334. Again, all the services at Carolina Medicare are free to you. Use Kevin to do the due diligence for you to find out what's best for your situation. Again, that number, 843-868-MEDI, that's 6334. Kevin, enjoyed it. Have a great week. We'll do it again next week.
Sounds good. I'll talk to you next week. Take care, y'all.
This has been Medicare Made Simple with Kevin Geiger. To talk with Kevin, call 843-868-MEDI. That's 843-868-6334. Kevin is also online with your resource on all things Medicare. Visit carolinamedicare.com.